organization. More than 500 people have lost their lives to the Ebola outbreak in the Democratic Republic of Congo. Updates figure from the UN Health Agency show that the Ebola outbreak in Democratic Republic of Congo has resulted in 1,561 confirmed cases and 506 confirmed cases of deaths since it was declared in mid-May. 2 additional deaths have also been reported in neighboring Uganda. Atul is back on the telecast with me. Atul, what more can you tell us? There are the number of deaths in Congo due to Ebola have crossed 500.
Well, yes, the 500, that mark has been crossed by the death toll when it comes to Ebola in Democratic Republic of Congo. Now, to be precise, in fact, 506 deaths, as the number stands right now. And this is quite significant because the outbreak was declared in mid-May. But the spread of the disease is quite faster compared to the response of the efforts being made by healthcare agencies as well there. But what we're learning is that this outbreak is particularly centered and heavily affecting some of the eastern provinces. In fact, one of the eastern province, Ituri, accounts for 90% of all the infections that we have learned so far. Now, what is more concerning is that health officials say that apart from these 1,500 cases that they have identified so far, there are thousands of contacts that are yet to be monitored. And as you know, it is very, very essential to track and trace them in order to break the chain of transmission, to break the the spread of the virus. But that has totally not been happening at a great pace. In fact, authorities are playing a catch-up role out there. And as we know, there aren't any approved vaccine or licensed treatment for it, despite the fact that WHO has been launching large-scale clinical trials to test new drugs. But so far, there hasn't been much success on that front. So clearly, Ebola has sort of gripped the Congo when it comes to death toll and in the spread of infection.
All right.